Oh, come on, relax. There you go. Good. 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 Loose. Let it go. There you go. Good. She has tight ankles. I think it's a big part of it. So you're going to feel a little release here.
Okay. Oh, wow.
Hey everybody, it's Dr. Warren Kalkstein here at Kalkstein Chiropractic. Welcome back. I'm with Sarah. Sarah, say what's up to the YouTube family out there.
Hello.
Getting ready for medical school in the fall, and last couple of months of working in here. You've seen Sarah from past videos. If you haven't, if you're new to our channel, or if you are kind of coming in randomly from some other video, I'm a chiropractor in Baltimore. Sarah is an assistant here in our office. She's a collegiate volleyball player, and she's been dealing with some low back pain over the last 6 months. And we've really focused in a little bit more on strength training over the last couple of months for her. She's been working with our trainer that works here. His name is Patrick, and that's made a big progression in her back pain. She's been in a better position to really be explosive, to work out hard through some of the lunges, as well as outside of here too, which is awesome. You're out of the low back exercises and moving on up into a little bit more of a progression. How do you feel doing that?
Much better.
Yeah, so she's been dying to get after it a little bit more.
Yeah.
Overall, probably feeling good, working out again, all the good things that come with it, but just getting past a really pretty significant back injury. So what was going on with Sarah? Sarah, using some of the medical terminology that you just have inherently, because you're destined to be a doctor, what was going on with your low back? What was your diagnosis?
I have a bulging disc at L5S1 and some radicular pain and tingling.
When you think of your disc, what do you think the material is like? What would you
like
describe
jelly?
it?
Is that what they used to describe it?
A lot of people, yeah, for sure. That's what you think. So in the inner portion of the disc, it's called the nucleus pulposus. Think of that as almost more like crab meat, almost. Like it's fluid, but it's still very dense, and the outer shell is actually almost a little bit harder than that. Like think about plaster almost, in terms of how dense that material is. So that's how strong the discs are in your spine. It's a really, really dense collagen that gets formed over force over time. So when you see a change like that on the MRI, and you called it what? A disc? Bulge. Yeah, there's different types of things that can happen to the disc. And do you remember where your disc bulge was?
L5S1.
Do you know what direction it was going?
Central disc protrusion.
Perfect. Yeah, exactly. Sometimes it can be lateral, sometimes it can be central, sometimes it could be
a little to the right.
A herniation, sometimes it could be sequestration. There's a lot of things that can happen to the disc, and those things present with different symptoms. A central disc bulge will present like you had. And tell us a little bit about the pain that you had with this central disc bulge at your L5S1.
So a lot of the pain was like all across my low back, and then it would go down both my legs.
Would it jump from side to side a little bit?
Sometimes, but I think it's a little more on the right, the bulge, so most of my bad symptoms were on the right side, and my left would just be occasionally.
Yeah,
I'd go back
and there's transitioning nerve roots that can get impinged when we have that type of a problem, and yours was definitely getting a little bit more on the right side. So that was part of your symptoms. And then what was aggravating you the most with those symptoms? And the reason I'm doing this, and we'll get to the treatment side of things here in a second, but you might be able to relate to some of the symptoms that she's having or had in the past. So sorry, go ahead. What would aggravate it?
Sitting for a long time, standing for a long time.
So
really any position for an extended time.
Okay. What was worse, sitting or standing? If you had to sit and do a lot of work, remember
I think standing was worse.
Okay, gotcha.
Sitting it would take a little bit longer to get bad, but standing it would be 10 minutes and then it was bad. As opposed to 30 maybe.
When you stood, was it more pain in the back or in the legs? Or is it both?
Both. Probably worse in the back. These days it's more leg pain.
Did you have more pain in the legs?
No. That was mostly only back.
Okay.
Until it got bad.
Gotcha. And now going through some of the things that we did in the very beginning, She had decompression therapy and adjustments. What gave you the most relief, and what was the biggest key to your success as of late?
I think in the beginning, dry needling helped the most for like a couple months, and then more recently the adjustments have been probably the best. But I think when it was really hurting, I started doing traction, and that helped, and then I went more to the adjustment side.
So it's been kind of a journey in terms of what's helped and what hasn't.
A little mix of things.
Okay.
But recently the adjustments, I think, have done the trick for the most part. Yeah.
Okay. I got to watch a little film, which is helpful when I have an athlete come in and they say they have pain during their sport. That was a big thing for you coming in, was jumping. When she would jump and come in after playing and coaching for a little while, the way that she was landing was putting a lot of shear like this on her low back, because she would launch herself forward, and then when she would land, her hips would travel forward and she would land into their toes a lot, right? Into her quad. She's really quad dominant, especially in the style that she lands. You can just see it on the film. Her hips shift forward and she kind of catches herself like this, right? And when you do that, where does the pain kind of build up? Right at that segment that's kind of taking a lot of that sheared force. L5S1, right? And maybe that's a little bit of where that pain came from and problem came from. It's a really explosive sport. It can cause some pain like that, but it's good to know through conservative care you can get better. Mm-hmm. And now you're getting stronger and really challenging yourself to grow a little bit too in the process. So it's good. Now, what makes her more prone to doing that? I think also just the natural form of her spine. It leads her to be really explosive when she pulls herself back and she whips her body forward. She's already kind of got a good, she already does a good job of extending her low back. She naturally has good lordosis in her spine, but maybe it puts a little bit more force on her low back when she lands. So you got to rob Peter to pay Paul sometimes, and this is one of those cases, right, where she's got one thing going for her, but it affects her in a different area of the sport. So what's lordosis?
The curve in your lumbar spine.
And in your cervical spine.
Yeah.
And then kyphosis is going to be more on the sacrum and the thoracic spine. So if you look at her low back, and if I take my hand down, this is where her thoracic spine is, and then this right here is a little bit of a dip, and that's good to have a curvature in your low back. Curves in the spine are natural. They help us stand erect and transmit force from the head down to the toes, but hers is a little bit more than most people, okay? And because of that, right here in her low back, right at this level where her sacrum and L5 sit, she gets a little bit of that pressure, pain when she's standing. She tends to shift like this and just rest on her hips like that, right? And that'll cause a little bit of discomfort in those areas as well. So we're really working on pelvic control in our exercises in DNS. And we've talked 25 minutes about what we're doing with Sarah, so we're going to go ahead and show you how I adjust her, okay? And then Luke, if you flash through some of those images, the dry needling, the exercises, as well as the traction table, I think it'd be nice to see what types of conservative care support a disc bulge, right? And just remember, if you're someone that comes into that problem, Sarah, I'm going to work on your mid-back first, okay? If you're someone that comes in with that type of problem, have a little bit more faith in the structure of the disc. It is not a jelly donut.
I've been told that.
Crab meat with a plaster on the outside. If that gives you more faith. No, it's really, really tough. It's really, really firm. It's hard. And breathe in for me. Easy exhale. Oh, come on, relax. There you go. Good. Good. Easy control. Good. All right, relax for me. And so I adjust Sarah full spine. I'm just worked in her thoracic spine and adjusted her mid-back. And then I'm just going to come in and I'm going to check her first rib here, okay? This is where she gets a little tighter than anywhere really on her spine. So right here over this first rib, I'm going to roll into this adjustment a little bit differently than you might see. And Sarah, relax for me. So I'm really going to take the trap out of the equation and I'm going to come across into the rib. And you got to trust me a little, Sarah, here to let that go. Perfect. And fall. Good.
Oh my God.
Take a deep breath in.
Oh.
Easy exhale, loose. And this is a little bit more C6, C7 to set. You see that pressure that builds there? Good. Good. Nice and easy. Sarah, do me a favor.
Mm-hmm.
Lift your head forward and drop your chest. Just check. Okay, now come onto your side, face me. So she had a little bit of muscle weakness, nothing significant in her low back. But with certain disc bulges, the way that you adjust it and the order that you adjust the spine is really important, in my opinion. And clinically speaking, you get better results. Breathe in. So for her sacrum, L5, S1, and she's already just moving. Loose, let it go. There you go. Good. Come on the other side for me. Rest. Good. And easy. Good. And relax. Liam, you can come over on this side, and I'm just going to show people what I'm doing. So this is her problem spot here. I'm rolling the SI joint down and in and rotating, and I'm using compression from my top hand and my legs to create a momentum right over that lower lumbar spine. So it's here, here, and there. Come on your back. Oh Lord, it's been a long morning shift. I don't know what I'm doing. This is not a smart decision, but hopefully I make it through the rest of this video right now. So I'm really grateful for Sarah. She's awesome co-worker, and she's been doing a really nice job, and I'm excited for her and her career. And a lot of the CAs, like, just watch our channel, get to know some of the people that work here. They're just awesome individuals, and it's just cool to be around an environment where so many people are kind of working towards that career path in health, and love helping people. It makes for a fun work day. All right, so again, she doesn't do a good job of landing on the heels. She shears her feet when she lands in her jump. It just over and over again. So because of that, she has tight ankles. I think it's a big part of it. So you're gonna feel a little release here.
Oh, wow.
Sarah liked that one, if you can't tell. She was a fan.
Good.
All right, not as bad here, but a little bit more internal rotation, and then I'm gonna scoop over the mortise joint, and it already moved.
Wow, that was good.
Just get your feet worked on, people. Make you happier. Sarah's laughing.
Seriously?
Come on.
Oh, that was really
We need
good.
more footwork, more happy people in this world.
I need better ankles.
Yeah, a little bit better ankles too. That'll happen. If you have questions about what I was working on and her treatment plan, and she works here, so she's got access to care, and that's why we've been able to progress so much, and she's lifting heavy now, even with the history of a disc bulge. Post below. Thank you for watching. If you're new to our channel, subscribe. Check it out. Liam is the man behind the camera, and we're going to be doing lots of videos like we always do, but really I'm excited to work with him before he goes to school. Give Liam a shout out. He just works here tirelessly and has fun, but has been with us for like a year and a half. Liam, how long?
2 years next month.
We've gone to concerts together. We've gone to, we've gotten to go work on artists together. We've gotten to travel down to homeless shelters in the city. He's coming here daily. He always shows up on time, works hard. And he's the quiet man behind the camera, but we couldn't do it without him. So thank you, Liam.
No problem.
Cool.